The first case of novel coronavirus was reported in Wuhan, China in December 2019. Early cases were believed to be linked to a live animal market in Wuhan and have since been spreading from person to person. Shortly after, cases of the virus began to appear outside of China, and on January 20th, 2020, the first case of novel coronavirus was reported in the United States. On January 30th, the World Health Organization declared the outbreak a public health emergency of international concern.
More cases should be expected in other parts of China and possibly other countries.
Coronaviruses are a large family of viruses, named for their shape, protruding spikes that look like a crown or a corona. SARS and MERS are part of the coronavirus family, as well as viruses that cause the common cold. The 2019 novel coronavirus was officially named COVID-19 on February 11th by the World Health Organization. Suspected community spread was first reported in the United States on February 26th, with no known links to people who've traveled to Wuhan, China. WHO said on February 27th that COVID-19 has pandemic potential.
This virus does not respect borders.
COVID-19 can cause flu-like symptoms that range from mild to severe, including cough, fever, and shortness of breath. Since the infection can include symptoms similar to pneumonia, influenza, and the common cold, only a diagnostic test can confirm whether or not an individual is positive for the virus. Thousands of people have died around the world. The first deaths in the United States occurred on February 26th. There are trials underway for treatments, but vaccines are still in the development phase and likely more than a year away. CDC officials say that Americans should prepare for major disruptions to their daily routines. Recommendations to reduce the risk of infection include regular hand washing, covering mouth and nose when coughing and sneezing, avoiding close contact with anyone showing signs of respiratory illness such as coughing and sneezing, avoiding touching your face, disinfecting frequently touched objects and surfaces, using an alcohol-based hand sanitizer if soap and water aren't available. If you're sick, stay home. If you're experiencing severe symptoms or are worried that you've contracted the virus, call your doctor before going in.
The vast majority of patients with the new coronavirus recover successfully without needing serious medical attention. So how many people recover and what helps? The WHO estimates at least 80% of COVID-19 patients have mild cases of the illness. In these cases, hospitalization is likely unnecessary, and the virus feels more like a cold than a deadly disease. Symptoms include fatigue, light fever, and a dry cough. Even in more serious coronavirus infections, most cases are not fatal. Officials are still working to determine the true mortality rate. Current data suggests it could be around 3%. But many experts stress the data is still very incomplete. The true mortality rate could be under 1%. That's much lower than some early estimates that were as high as 5%. There is no cure yet for the new coronavirus, but there are some general recommendations for recovery. Get lots of rest, make sure to drink fluids. Painkillers and cough medication can help relieve symptoms. But don't take antibiotics, they won't help. It's still unclear whether existing antiviral medications could be effective. Scientists are trying to figure that out. So let's say you've recovered. Does that mean you're immune from getting the new coronavirus again? Unfortunately, that might not be the case. There have been isolated cases of patients testing positive again after seeming to recover. But how should we interpret those results? Doctors say it could mean one of several things. The coronavirus might lie dormant in patients before causing symptoms again. Or testing irregularities might have just made it seem like the virus was gone when it wasn't. As with many aspects of this new ailment, the definite answer is not in yet. But one thing